Now we're going to kind of meet the winning companies. About 90 seconds each for them to introduce themselves, what problem they're solving, how they're solving it, what are some of their accomplishments to date. I'll try and ask a smart question to follow on.
Great to be here today. I'm Dr. Davis. I'm a founder and chief medical officer at PreventScripts. After practicing for 15 years of pediatrics in St. Louis, I moved back to Kentucky where I was raised, and there was really a stark contrast. And the thing that impressed me the most after having been gone for such a long time was the sudden cardiac deaths of high school friends in their 40s. So something really horrible happened here for the decades I was gone, and we call it cardiodiabesity. As a physician, I had a complete lack of knowledge around affecting patient behavior change in my checkups. And in that year between checkups, patients would go home, gain 10 pounds rather than lose any. And so PreventScript solves that blind spot problem. That year in between visits when patients progress from risk into full-blown chronic diseases like diabetes and hypertension. Unlike companies like Noom and Weight Watchers, our approach leverages the unique relationship between the patient and their primary care provider. And we provide a workflow-friendly and electronic health record embedded platform that helps physician groups and health systems add proactive preventive services that increase clinic revenues, normalize key biometrics like blood pressure and weight, and also deliver a 4-to-1 return on investment.
Fantastic. And it's in your name, Prevent Scripts. You sort of, as a pediatrician or primary care, you prescribe exercise or some change
Yes,
in lifestyle for the entire
yes.
family. Give me a quick vignette of what that would look for a particular patient.
Let me give you an example, a good example. This is Jesse, who is a construction worker in Clarksville, Tennessee. Jesse came in to our customer's clinic in February. He filled out our preventive assessment, took him 3 minutes, and he found he was at high risk. You know, we color code his diabetes risk and his weight and his blood pressure in our mobile interface. And he was diagnosed with sleep apnea and morbid obesity. He filled out the survey in subsequent visits, and then in July, he pulled the trigger and enrolled in PreventScripts, downloaded our app. And over the course of that year, he utilized our program, connected scale, tracking in our mobile app, and he picked Eat Less Sugar as his primary goal. And he filled out our surveys, checking in on how he was doing with eating less sugar. We utilized the 5A preventive counseling approach. And over the course of that year, he did his visits with his provider, monthly remote monitoring visits. And in a year, Jesse had lost 80 pounds, normalized his blood pressure, his blood sugar, and his weight by 22%. And interesting thing about Jesse, his provider tried to prescribe him GLP-1 drugs and was denied and had to do an authorization and had to do an authorization again. And by the time his provider got around to, by the time that his insurance company got around to the GLP-1 drug prescription, he had already lost 100 pounds and felt like he could do it on his own.
As we know, again, I'm trained in pediatrics and internal medicine, but we've also seen a dearth of solutions in the pediatric space, or they don't get adopted or paid for, just like in the challenges across the adult world. What lessons have you learned that are unique to getting solutions out into the kids space, whether it's a pediatrician, physical therapy, and beyond? Any kind of quick lessons or insights?
I have an idea of how we did it at PreventScripts. I have found that for providers, they really want to have a discrete return on investment on your product, and they want that return on investment to happen fast. And so for our product, we managed to take a variety of CPT codes that pediatricians and family medicine doctors use in their day-to-day practice that are prevention related and match the features of our product to those codes. That enabled us to create financial pro formas for our customer prospects that will show them using our platform it's in a similar way to a drug rep who is walking into your clinic and is showing you, this is an immunization, grid, all of your payers, and here's the reimbursement you'll get using our vaccine or our drug.
Right.
And we found that to be helpful.